Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today we'll continue our course in history taking and today presentation on hemoptysis. My name is Ahmed Al-Hadidi. I am emergency medicine consultant. There is many causes for hemoptysis, general causes like bleeding disorder, cardiovascular causes like pulmonary edema, mitral stenosis, aortic aneurysm, and also traumatic causes like post-intubation or foreign body. Also, there is infective causes like bronchitis, which is the most common cause of hemoptysis, pneumonia, lung abscess, bronchiectasis, tuberculosis, and fungal infection. There is also malignancy, either primary or secondary malignancies. Vascular causes like pulmonary embolism, Osler-Weber-Rendos disease, AV malformation, parenchymal causes like sarcoidosis, hemosiderosis, diffuse interstitial fibrosis, and cystic fibrosis. Alveolar hemorrhage syndromes like microscopic polyangiitis and ANCA-associated vasculitis, and granulomatosis with polyangiitis, Codd-Bastère syndrome, systemic lupus erythematosus, Behçet syndrome, and cocaine inhalation. To start the station, as we agreed, the station for history taking, there is set, dialogue, and closure. The set or introduction, we start with greeting and introduce yourself. Hi, I am Dr. Hadidi, SHO of Internal Medicine Clinic. And confirm patient details. So you are Mr. Muhammad and you are 55 years old. Then build good rapport by, please have a seat. May I sit beside you? Then explain, note taking. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Is it okay with you? Then agree the agenda. I have received a letter from your GP stating that you are coughing of blood. Is it right? After that, we'll go for the dialogue and start the dialogue with present history and the presenting complaint. Can you tell me more about how did you cough blood? Are you sure you are not vomiting blood instead of coughing up blood? How much blood have you expectorated? Is it frank blood or blood-stained phlegm? What is the color of the blood? Is it pink, frothy, bright red, or rusty? Then we'll analyze the presenting complaint by Udbara. So O stands for onset. Was it sudden, chronic, or chronic and recurrent? Then duration. When was this first noticed? Then progression. Do you cough blood daily or once or twice? Then aggravating factors. Is it worse on lying down, like in pulmonary edema? Or does it increase on exertion, like in mitral stenosis? Then regressive factors, like does anything makes it better? Then associated symptoms, like do you have increased phlegm with mild bleeding, like in bronchitis or pneumonia? Do you chronically produce large amount of purulent phlegm, like in bronchitis? Do you have hoarseness of voice, like in cancer? Do you have fever, shortness of breath, arthralgia, and skin rash, like in systemic lupus? Do you have hematuria, sinusitis, or otitis, like in vasculitis or Wegener's? Do you have acute chest pain and shortness of breath and leg swelling, like in pulmonary embolism? Do you have heart racing, like in mitral stenosis, which causes atrial fibrillation? Do you bleed from anywhere else in your body? Do you have any gum bleeding, nasal bleeding, or rectal bleeding, like in bleeding tendency? Specific question, have you had a recent throat or chest infection? Have you been in contact with anybody with tuberculosis? Do you have recent history of immobilization or surgery, which is a risk factor for pulmonary embolism? Is there any history of trauma to the chest or foreign body inhalation, like traumatic hemoptysis? After finishing present history, we'll go for past history, medical and surgical history. Have you ever been diagnosed with any medical condition? Have you ever been hospitalized, and for what reason and for how long? Have you ever had any blood transfusion? Have you had any recent lung surgery or bronchoscopy? Is there a history of heart, lung, or kidney disease? Do you have any history of bleeding tendency, blood disease, or blood formation? Do you have a history of cancer? After that, medication and allergy. Do you currently taking? Are you currently taking any medication? What medications are you taking? Any over-the-counter, any herbal remedies? And specifically ask about, are you currently taking aspirin or anticoagulants? And of course, don't forget to ask about TB medications. Have you ever had treatment for TB? What medications were given and what was the duration of treatment? Were you compliant to medications? Was the TB therapy directly observed, like hospitalized in the hospital? And of course, ask about allergy. Do you have any sort of allergies? Then family history, it's very important, and usually people forget to ask about family history. Is there a family history of malignancy? Is there a family history of bleeding disease? Anyone in your family has tuberculosis? Then social history, ask about smoking. Do you smoke? And how much do you smoke and for how long? Do you use recreational injection drugs? Have you ever shared needles? Have you traveled overseas in the past year? Have you had any tropical illnesses like histoplasmosis and tuberculosis? What do you do for a living and what's your occupation? Have you had any previous occupations? So you ask about current job and previous job. Have you ever been exposed to asbestos, coal dust, or other toxins? How do the symptoms interfere with your life? Does it interfere with your work, with daily jobs, or daily work, or even with sleeping? How far can you usually walk without stopping, and what stops you? Then before ending of the dialogue, ask about ideas, concern, and expectation. What do you do? What do you think might be causing this problem? Concern is like, are you worried about this being anything in particular? And expectation, what do you think might be best plan of action? Then the closure. And in closure, we ask about, we first summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Ask about any outstanding issues. Is there anything else we haven't discussed that you feel is important? Then create a list of problems. So from the history you gave me, I think you mostly have blood clot in the blood vessels of your lung. Then I will examine you first. We will need to do some tests in the form of blood test and maybe some imaging. And of course, you need to be admitted to the hospital and we will start you on blood thinner medication. Then don't forget to counsel on health promotion. Like there is an advice I need to tell you about. Smoking is not good for your health. And I am going to arrange another meeting to help you to quit if you wish. Is there anything unclear you need me to clarify at the end? Thank you, Mr. Muhammad. Thank you so much. These are other presentation in our channel.